So, good evening, friends. Today, here I am with the most awaited topic, that is the Neet PG 2021 200 questions. Yes, my dear friends, it is 200 questions, all memory based. So, mistakes may happen in the clarification as well as in the literature of the question, also. So, please ignore it because it's all memory based. So, without wasting time, we started the discussion. Now, the first question, I just try to draw the image, my dear friends. So, the first question is this. Suppose it is the forearm. Suppose it is the forearm, and these are the elbows where you can see some very hard nodular like lesions, and this is nothing but the vitamin E deficiency, rhinoderma. Yes, my dear friends, it is rhinoderma. Next, the relation with CRP and MI. It's a PSM sort of question. That is the answer is positive relation. I missed some of the literature of the question. Next, question 3 is gross picture showing the prostate and bladder. So the answer is the bladder cancer. Next question, child X-ray which shows such findings. I already discussed in my previous video about this white line Frankel, which shows the scurvy. Next question, number 5. A 60-year-old female presented with the history of Colles fracture complained of the backache. Which of the following is wrong? So, teriparatide should be administered before bisphosphonate. This is the wrong statement in this context. Next question, number 6, is patient fell down from the bicycle and started having pain around the hips, shortening the limbs, and the attitude was the flexion and adduction. So what it is? It is posterior dislocation. So the answer is posterior dislocation. Now what can we do for the test of median nerve? So pen test we do for only the testing of median nerve. Next question, number 8. 20-year-old boy presented with a gum bleeding and easy fatigue, fever for 1 month. Hemoglobin is 3, TLC is 1.5, platelet is 15 into 10 in power 3. Petechial rashes is also there all over the body. The peripheral smear also shows the macrocytes. Bone marrow shows the fatty streaks. Absent megakaryocyte, no immature cells. So what it is? It is idiopathic acquired aplastic anemia. Next question. Tolizumab acts on the interleukin 6. It's all one-liner. Image of the papillary growth over the bladder, which you can see in your radiograph, as you remember. Then it's all the bladder cancer. Next, to the industrial worker after injury to the eye with a hammer with a chisel. Yes, tomorrow I just say it is MRI, but the answer is actually MRI is contraindicated in this. Next question, a female has the miscarriage of with the 3 times IOC, miscarriage for 3 times. So investigation of the choice is hysterosalpingogram. Next question, patient on the ATT with contracted TB. Which are the drugs which will inhibit the OCP? So the answer is rifampicin, as it will induces the metabolism of the OCP. Next question is post mastectomy swelling of the upper limb is due to lymphedema. Next question, number 15, safest antihypertensive for the end stage renal disease is aliscarin. So it is because it is a direct renin inhibitor. So it is useful in the end stage renal disease. Next question is 16. Hypertensive woman wants to conceive. Which medicine she needs to stop? So the answer is in the given options, that is ACEI, angiotensin converting enzyme inhibitor. Next question, number 17, is GPCR acts by adenylate cyclase for beta 2. Next question, number 18, is hernia patient whose hernia is coming from the medial inferior epigastric artery, and what is the repair mechanism? So it is a direct inguinal hernia and the repair is by the Lichtenstein repair. Next question, patient is on digoxin therapy, develop the atrial fibrillation because of which drug? So the answer is clarithromycin. Some people will say it is KCl, but it is clarithromycin. Now, chronic alcoholic patient with increase in abdominal girth level biopsy shows the reddish inclusions. What are the contents of these inclusions? The question is, so intermittent filament. The answer is intermittent filament. Next question is, there is an image which will show in the opacity in the pupil of the child. This is what the congenital glaucoma. That will show the congenital glaucoma. Now question number 22 is the X-ray of the spine. I just try to draw a very bad spine of the patient, but I just want to focus over the pattern. So it is a dagger-like pattern, and that shows the ankylosing spondylitis. Next image is of the kidney. It is a mass of the kidney seen in the radiograph. That is what the putty kidney. This is not the staghorn calculus. There are some differences in between that. Now another X-ray, question number 24. This shows the in the back side you can see there are spine, and over which you can see the pattern coiled spring sign. See the coiled spring sign, which will show the jejunal obstruction. Now next question number 25, HSG with Wilkinson's cannula. HSG which shows the Wilkinson's cannula. Next question is X-ray having showing in the gas under the diaphragm. This was asked in different pattern. The language may be differ, but this type of question appear in the exam. So what else? If you have much more literature about this question, please text me in the comment box. Now question number 27. Suppose this is the arm and forearm. So picture of the forearm is showing the reddish wheel-like appearance. This is called about the lymphangitis. Next question, suppose this is the picture of the scalp showing this center part, just like multiple folliculitis in this scene in this pattern, and this area is non-hairy, but this area is hairy. So that is what called the chirion. This type of appearance is of chirion. So this is the pic of the scalp, imaginary pic of the scalp, my dear friends. Now question number 29. Now what is this? Now this is the Gaucher's disease. I just try to draw the pathological slide in this, in which such appearance we see for the Gaucher's disease. It is deficiency of the cerebrosidase enzyme. Next question. X-ray which shows the dark appearance and swelling, that is the GCT, giant cell tumor. The swelling is also present as the picture comes in the exam with radiograph as well as a physical picture also shown. So this is the question. Now which vessel aneurysm impinges on optic chiasm? So it is the anterior communicating artery. Next question. Child with unilateral wide papillary reflex for which surgery is done? Biopsy will show the Flexner Winter Steiner Rosette plus. So answer is the retinoblastoma. Now question number 33 is snowman appearance is seen in which? That is TAPVC. Next question. Patient comes with complaint of unable to see forward to unable to see towards the right side with both the eyes. So what has happened? Injury to the left optic tract. Now alternative for the patient who don't want to wear the specs for myopic astigmatism. What is the alternative? So intraocular lens is the alternative, right? Now next is corneal transparency is maintained by which of the following glucosaminoglycans? So it is the keratin sulfate. Next question, which of the following amino acid need to be supplemented to the diet whose deficiency of the cysteamine synthetase? So answer is the cysteine. Yes, direct cysteine is administered in that. Now next question, patient with vomiting treated with the antiemetics, patient got relief but a non-movement seen, which is managed by the benzhexol. Sorry. Next question number 39, patient with the contact eye lens since 2 years. Images show the picture of the uh, growth papillary growth over the everted eyelid, and that is the giant papillary conjunctivitis. Now question number 40 is what patient is present with the dryness, gritty sensation with corneal softening. What it is? It is a vitamin A deficiency, that is the retinoic acid deficiency. Now next question, patient blunt end with no nuclei. The organism is Wuchereria bancrofti. Question number 42, patient with the injection of the pastry followed by the vomiting. The most common organism is Staph aureus. Many people will say the Bacillus cereus also, but the final answer is Staph aureus. Question number 43, blood spilled infection. The chemical used is sodium hypochlorite. Next question, case of the measles. So the type of the virus is single-stranded virus. For the outbreak, next question, for the outbreak of the buboes, so the vector is Xenophthalaceophis, that is the red flea. Question number 46, fever in UP with organism with kinetoblast in the macrophages. The case is of the leishmaniasis. Next question number 47, the mismatch repair defect is seen in HNPCC. That is heredity non-polyposis colorectal cancer. Next question, the black urine, the alkaptonuria due to deficiency of the homogenetic dehydrogenase enzyme. So this is the question number 48. Now question number 49, patient had dinner at 8 p.m. and develops the blood sugar at 7 a.m. Then from which source the glucose will come? So the liver glycogen is converted. Question number 50, patient with tendon xanthomas is increased LDL and cholesterol. So type 2 hyperchylomicrosomia is the answer. So 50 questions are completed, my dear friends. Great saphenous vein graft is used in CABG. Next question, following operation, patient developed loss of sensation from medial aspect of the thigh. So which nerve is damaged? So which nerve is damaged? Saphenous nerve is damaged. Now the 11-year-old boy with fever, sore throat and throat swab is taken, which is discarded in the yellow bag. So this is question number 52. 53 is metrogel is indicated in various anaerobic infection. After prescribing metronidazole, you will warn it about, answer is alcohol, because it will create a disulfiram like reaction. As you already know the detail. Question number 54, a woman is presented with the ENT OPD with complaint of the nasal obstruction, and on examination greenish black crust is seen covering the turbinate. So it is the case of the atrophic rhinitis, and the another feature is roomy nasal cavity, which is given in the option of atrophic rhinitis. Now question number 55, 35 years old male presents with epistaxis. Conservative management done to stop the bleeding, but it is failed. What will be the next management? So it is the TESPES. That's artery of the epistaxis. We have to ligate. Next question number 56. Marbling is done due to deposition of the sulfate hemoglobin. My dear friends, I'm very sorry I'm not able to write the full questions because it will consume so much of time, and your evaluation is also going to be delayed by that. So question number 57, most important for TB pelvis is seen is C mark point. Now question number 58, after dilution of the serum test is positive, that is called the prozone phenomena. Next question, old question of the software engineer, which I will discuss in the yesterday video. And after so much of discussion, as he ordered the fast food, so it was the folate deficiency, not the B12 deficiency, according to me. Now question number 60, female which complained of a discharge last 2 weeks, white discharge, cycle is regular, no itching is there, so it's all physiological. Next, even E2 and E3 complex picture is shown in the exam, where even is the pyruvate dehydrogenase and E2 is the dihydroxy transacetylase. Question number 62, RTA with abdominal injury, patient is stable, so what you will do? Fast. Next question number 63, most radio resistant tissue is, answer is nerve. Now the question number 64, RTA pneumothorax seen, needle is placed in, answer is fifth intercostal space at the mid-axillary line. Now short stature cubitus valgus is seen, the answer is Turner syndrome. Another question for Turner syndrome, in which type of ovary is seen, so streaky ovary is seen. You may better know the literature, what comes in front of your eyes, because it's all memory based, right? Question number 67, pap smear will detect the, it's a large type of literature with irregular margins and all, but the final answer is dysplasia. Now question number 68, mediastinal mass with red cell aplasia, that is called thymoma. Next question, question number 69, leprosy patient on MB multibacillary treatment develop the rashes. So what you will do, we will MDT with steroid. Next question number 70, 36 week of gestation, painful blisters on the vulva is seen. What is the management? So acyclovir and C-section will be done. Now question number 71, first abortion at 6 weeks, second at 11 weeks, third by 24 weeks. So answer is syphilis. The Kasowitz law. According to Kasowitz law, it is syphilis. Now question number 72, child with hydrocephalus underwent operative correction. Literally, later he developed the irritability. He or she developed irritability. Temperature is 38.3. So what we'll do? Culture from the lumbar puncture. Lumbar puncture is taken. Question number 73 is a child myoclonic seizure posted with the history of the fever and rash on the first year of life. So what will you do? CSF, IgG, SSPE for SSPE, right? Now question number 74, elderly female localized headache, jaw claudication, best management for the diseases. So it is the giant cell arthritis. All these features are of giant cell arthritis. So the management is of prednisolone. Now next is squamous cell carcinoma with black pigment hilar nodes, that is called anthracotic. The answer in this context is anthracotic. Question is 76, palpable purpura arthritis abdominal pain, all it is indicative of the HSP, that is henoch-Schönlein purpura. Next question 77 is affected cell in multiple sclerosis oligodendrocyte. There may be some point of debate over this question, so you may welcome in the comment box. Next question number 78, best for the gestational age at 6 weeks is crown rump length. Now question regarding the acute pancreatitis, the enzyme involved is lipase, serum lipase is the answer. Next question number 80 is miliary shadow seen in the lung field. The eosinophil also increases. What it is? It is tropical pulmonary eosinophilia. Now next question number 81, if urethral injury is present, what is the answer? That suprapubic cystotomy is done. Now question number 82, confirmation of the ET tube is done by the capnography. Now question number 83 is global hunger index included all not included, which is the infant mortality rate, that I corrected from my yesterday video of the 50 questions. So history of the halothane used along with some muscle relaxant that causes the muscle rigidity, fasciculations, malignant hyperthermia. Sorry, in this regard, the succinylcholine is the best answer. That is SCH. Next image of the feet staying in water for more than 36 hours. Answer is the washerwoman feet. Washerman feet. Now question number 86 is septate uterus. What is the management? So septum metroplasty is the management. Again, there is a debatable question. Multiple answers are given by the students. Now question number 87 is still the alcohol withdrawal 3 days ago. Hallucinations are there, seizures are there. So what is this? It is the delirium tremors. Now question number 88, CAAP, that is a 2A asymptomatic and 2B symptomatic. Only very little literature I will get about this question. So this question is I will keep in doubt. So now question number 89, history of increase in cholesterol, increase LDL, that is of familial. Answer is familial hypercholesteremia. Now next question number 90, uterine anomaly show some point. This is also some incomplete question, but answer in this context is laparoscopy plus hysteroscopy. Next question, question number 91, that is pneumobilia, intestinal obstruction. Answer is pneumobilia is there, intestinal obstruction is there, so the answer is gallstone ileus, Riger triad. Now question number 92, nerve supply of the uvula is the 10th nerve, that is vagus nerve. Question number 93, use of the mitomycin and topical use of mitomycin as topical for subglottic stenosis. Now next question number, hand washing learning at school, apply this at home. What is this? Is cognitive and effective behavior. Now question regarding school health program. I will discuss in the later. I will get some literature about this. The answer is PSC, that is the primary health care. Next question is graph is showing the growth chart weight by age. That shows there is a graph, if you remember, that will show about the moderate malnutrition. Question number 97, over familial hypersexuality is seen, that is in mania. Now flat abdomen, below umbilicus, FHS is at the flanks. So what is this? Knee presentation of the child, of the fetus, sorry. Question number 99. Pregnant female taking warfarin at 8 weeks. Now what you have to do? Answer to stop the warfarin and shift it to the heparin. Noted friends, I am not able to write the full literature due to scarcity of the time. Now question number 100. Uh, mats at lungs are there. Choriocarcinoma is seen. Now what is the management? So EMACO is the management of this. If you have mats in the lungs, then EMACO is the best answer in that context. As I already explained 50 questions yesterday, so I directly start from 151 questions, right? So in question number 151, patient whose pH is 7.5, CO2 is 22, bicarbonate is 24. What is this? Respiratory alkalosis. Now, question number 152, patient is diabetic, high anion gap is seen, pH is 7.14. Answer is acute kidney injury among the options available. Question number 153, 10-year kid, which vaccine will got? So answer is the tetanus. In that context, the tetanus is the best answer among all the available options. Now RT2 ligate in the PPH. The order of the ligation is, so first you have to ligate the uterine, then ovarian, then internal iliac. Now question number 155, patient with MI, angioplasty is done, LVH is there, complaint of angina is on metoprolol. What to do? So you have to increase the dose of metoprolol. Question number 156, 4 pill missed. Now what to do? Among the options available, just continue the rest of the pills plus emergency pill you have to take as well. Okay, so this was the question number 156. Now beta 2 receptor action is on the adenylate cyclase enzyme. Question number 158, bronchial asthma with POAG. The answer is, what is the drug of choice? The lantanoprost will be, which we will give in that context. Now question number 159, Fournier's gangrene is which type of infection? So mixed aerobic as well as anaerobic infection. Question number 160 is health clinical management is checked by. How you can check it? By outcome. So patient with the chronic middle ear infection now present with the neurological manifestations, headache, vomiting. CT brain is showing the abscess. What is it? It is temporal lobe abscess. Next question, with a child with tonsillectomy lying bleeding on the ward. What is the best management? Take to the OT, remove the clot and religate that. 163 question number, patient showing the vial mitomycin C injection. PIC. Patient not, it is PIC showing the vial. You may remember one PIC which is showing the vial. It is a mitomycin C injection which is used for the subglottic stenosis. Now question number 164, patient of the thyroidectomy extubated and then he or she developed the cyanotic spells. So the cause is bilateral recurrent laryngeal nerve palsy. Next, question number 165, 16-month-old child, 8 kg on accessing the growth chart falls between the standard and -2 standard. Growth chart falls between this. So most common cause is the severe malnutrition. So refer to the NRC. Next question is, microscopic image of the papilla of the tongue is circumvallate papillae. Next question is, Anganwadi worker taking weight and height of the 4 years old child, finding the height for the age is less than -2 standard deviation. So what is it? Chronic malnutrition again. Now 168 number question, low air velocity is measured by the Carter thermometer. Next question, school health center is at the PSC level. Next question, question number 170, AQI is of 407, that indicates the severe level air pollution. Next question 171, the researcher with CRP values, where there are 4 CRP values basically, 1, 1.5, 1.7 and 1.8. But what will indicate? It will indicate the disease, increased disease risk and cancer risk. Next question, evaluation of the functioning of the health center is again by the outcome. This question I think is repeated. I will see later. Pregnant woman contraindicated for the varicella vaccine, was negative for even serum antibodies of the varicella. What you will do now? Actually, here the management is not asked, the risk is asked. So she is susceptible for the chicken pox. Next question. SI unit of the brightness or luminescence is LUX. Such type of questions I never expected, but it happens. 175 number. 13-year-old male with erythematous plaques over the face since 10 days. Patient is on the multibacillary treatment for the Hansen's disease. So what it is the type 1 Lepra reaction. Mind that type 1 reaction is always type 4 reaction and type 2 is type 3 reaction. Now next question 176, that is uterine didelphys will cause all of the following except endometriosis. Next question 177, lady on the OCP 5 months amenorrhea since 6 weeks. Best to calculate the gestational age is 280 days from the LMP, that is the last menstrual period. Question number 178, patient with post-molar evacuation, now he has the lesions in the lungs. So best management is the cannonball lesion. This is the cannonball lesions, right? So EMOCO regimen is the best management. Next question number 179, patient with the infraumbilical flattening and fetal head is heard laterally. Fetal heart sound is heard laterally. What is the presentation? Occipito-posterior position is there. Now question number 180. Husband asked for the paternal testing twins. One twin is son, other is not. Diagnosis is superfecundation. Yes, it is the case of the superfecundation. Question number 181. Teen patient with the transverse vaginal septum dysmenorrhea with chronic pelvic pain. The diagnosis is endometriosis. 182. Patient intubated for the surgery. Best method for confirming the position of the ET tube is capnography. Again, this question is repeated. So I will see it later. 183, carcinoma antrum plus head of the pancreas plus mets in the liver. What you will do? You will manage by the palliative as well as by the gastrojejunostomy. Next question number 184 is multiple air fluid level air under diaphragm is seen. What is the answer? That is a halo whisper. Sorry, this question is not clear. I will later mention. Next question 185, formal thought disorder, that is called the derailment. Next question 186, that is urine osmolarities increase, plasma osmolarities decrease. The answer is hyponatremia. Now 187 question, PPH positive lactation failure is there. What is called? This is the Sheehan syndrome. Now next question 188, rectal prolapse management showing the wire. Which type of wire is it? So it is the Seeds wiring. Now 189 question, calculate the sodium deficit of the weight 70 kg, sodium is 120 as the normal limit. So formula is this, you just multiply by giving all the things. So answer is 840. Next question 190, micturition on caffeine straining, that is called a stress incontinence. Next question, prominent A wave in the JVP with mild diastolic murmur. What it will say that it will tricuspid stenosis. Next image showing the injury. That is this injury is incised looking laceration. If you will remember the image, sorry I am not able to receive the image in this moment of time. Now next question 193, while recording the witness, the lawyer asked witness, did A kill B? Witness say yes. This is what the cross examination. 94, man working in the field collapses in the hot summer afternoon. Which of the following symptom least likely to develop? So sweating will not happen in that condition. Next question, upper lid coloboma, most likely complication is exposure keratitis. Now 196 question, 10-year child, upper limb hypertension, lower limb loss of palpation, notching of the ribs is there. As notching is there, so the answer is coarctation of the aorta. 197, increase about the leptospirosis along with doxycycline. So the answer is zinc phosphide. Now next question, 6 weeks amenorrhea, left adnexal mass 3 cm on the USG, beta SCG is 2500, no fetal heart rate. What is the management? So single dose methotrexate you may give. Now history of the primary uh, infertility, 2 fibroids in the carina and both sides of the tube block. How will you manage the treatment? By the laparoscopy, myomectomy. Now wrong about the pheochromocytoma. So beta blockers used alone. This is the wrong statement. Beta blockers used alone. Thank you, my dear friends. And shortly I will be there with some new videos of about the rank prediction and about the seat allotment. So stay with me. Thank you.